I think makes sense because
You've always had left side.
The left side is my enemy.
Yeah. If only you were all right. Get it?
That was terrible. Good one, Adam.
Thanks, Will. Love that. Big breath in, all the way out. Relax. All the way out. Here we go.
I love these things.
Aw, I love you. Hey patients, today we've got one of my more recent regular patients. I originally met this guy on Reddit. He was dealing with a long-standing golf-related injury in his left lower back. He'd seen other practitioners and it just really wasn't working out for him. Fortunately, he's actually doing a lot better and he was excited about being in a YouTube video today, so that's exactly what we did. Thank you guys again for clicking on the video. Please, if you don't mind doing one other click, that subscribe button down below. I really hope you enjoy and have a great day. Will. Really good to see you. Thanks so much for coming in. So Will is a pretty much regular patient and a great dude to be around now. He's been dealing with some low back discomforts when golfing, when lifting that have improved quite a bit. But, you know, he was willing to be in a video. So, of course, a guy this good looking, I figure we can up the female viewership.
There we go.
So,
Love it.
Will, why don't you kind of share a little bit about what your experience has been here so far and like how you have improved or gotten worse in the last week. I don't know.
Sure.
It's been a week. Yeah.
Yeah, I mean, I've seen a number of professionals over the few years here, and Adam reached out and connected with me. And
did I reach out to you?
Yes, you did.
I did.
Yeah.
Oh yeah, it was on Reddit.
Online,
okay, that was the Reddit. I'm a Redditor. It was that's how we found. Yeah.
I was looking for someone, and he happened to reach out to me. So. He kind of said, look, we'll get more into it, be more focused, and a little more tailored, and I've been coming, and my lower back pain has gotten tremendously better.
Woo! We love that.
And I've been enjoying my life a little bit more, which is the goal.
Very happy to hear that. And now I think I realize I forgot that you were the Reddit person, and that's why we kind of get along with a similar sense of humor. We're both nihilists.
Exactly.
Okay.
Exactly.
So no, low back, awesome. You mentioned you get a little bit of like neck, levator scapulae issues. We haven't treated your neck before, but we're going to do that today on camera. You've had your neck worked on before or adjusted?
Yeah.
Perfect.
Sometimes I think because I messed up this shoulder a while back, I think something with my trap and that sort of thing kind of caused some neck issues. Probably from staring at a computer too. Doesn't it help?
Lots of that these days. Okay, perfect. So we'll just get right into it. Again, he's a regular patient, so we're going to be able to skip quite a bit of the exam, but we'll get right into the treatment for you guys. Sound good? Perfect.
Sounds good.
So Will was mentioning that his lower back pain is feeling a lot better, but it started to creep up a little bit higher into his thoracic paraspinals. Could also be because you were snowboarding this past weekend. Yeah. So when you're snowboarding, obviously you can't really see me position here, but you're kind of rotated the whole time, right? Like your toes are facing one way, your upper body is obviously looking down the hill, so you know what's coming at you. So that rotation could cause some strain. Either way, we can absolutely work on that. Oh, that just popped. Yeah, it's a shame though because Reddit, like I love Reddit, but you know what Reddit hates?
What?
Reddit hates chiropractors. They really, really do. Like if you ever hop on a thread that's like, what's the most useless or snake oily profession? Chiropractors are like top 3. It's actually.
You think so?
Oh no, I know so.
Yeah.
I know because I've seen it like hundreds of times. So if you're a Redditor and you're watching this, I'm a Redditor too. It's okay. You're allowed to be wrong. It's fine. It's fine. Anyways.
What are the other top ones?
I think real estate agents are up there, which is unfortunate because my parents are real estate agents. Really, just my whole family. Actually, I think they're all just
every profession that you have in your family.
Oh, it's just terrible,
nice.
just awful. Yeah. And there's one other one too, and I can't. Something about healthcare and insurance. Yeah. Something to do with that, like the middlemen, right? They're American.
Insurance or something.
They're American, right? The things we don't have to deal with as Canadians.
That is true.
Something like that. Yeah. Take a breath in for me, all the way out. Good. All the way out. There's another one. Good job. You said it was really around here.
Yeah, that's the spot.
That's really the spot right there. Okay. We did adjust that, so we're definitely going to scrape that. Big breath in, all the way out. Relax. That was a really good one.
Nope, we're going to hold on to that.
I'm just going to lay in bed all day until I see it. All right, hips towards. Thank you.
And big breath in, all the way out. Here we go. You mentioned you have some issues with your levator scap. Which was that, the left or the right one?
The right side.
The right side. Yeah. Okay, so let's kind of start with this guy here. Right up. hope the mic's not picking up. Was that Lil Wayne playing in the gym?
Is it? I can't hear it.
I can't, okay, well, my hands are covering your ears.
That is true.
Yeah. I hope the mic's not picking that up, but oh.
Well, Lil Wayne's alright.
Nothing against Lil Wayne. It's just, the copyright music and whatnot. Yeah.
You think it would pick that up?
No, I don't. But it is a sensitive ass mic. I have heard the music in the gym on my videos before, and thankfully the system didn't pick it up.
Good.
But yeah. All right. So I'm gonna get you to turn your head just like that, and just relax for me. Good. Well done.
It's a good one.
Been a while since you've had that done.
Yeah.
Sink. Love that.
There we go.
Those are both very good. So, as Will was saying, originally his complaint was in that lower back. We determined that it was actually his psoas muscle, which we're very familiar with on this channel. But that's been clearing up. Now we've got this kind of little pain, little twinge in through the thoracic paraspinals here. So that's what we're going to really be focusing on today. Granted, we'll do kind of the whole everything, but this is where we really want to pay most attention to, where my finger is right there. So, we'll start off with our tools, like we usually do.
Well, that feels interesting.
Feels interesting, huh? Have you ever had like a massage before?
I have had a massage,
But not this.
not
one,
with
huh?
a metal
Not with a metal
knife
torture tool.
scraping me.
No?
Yeah.
Okay, well, first time. I'm happy to be your first. That's good. Yeah.
First for everything.
First for a lot of things, that's
Yes.
for sure.
There's been a lot of firsts in this room with Adam.
First good Chiro experience. Yeah, that's what I'm hoping for. Awesome. I hope you never forget your first good Chiro experience.
100%.
Yeah, 100%. Guys, are all Redditors like this? Is this what I'm like? This is a lot. Like,
How big is this thing that you're scraping me with?
so this one is actually the warm-up tool. I call it the shark.
Okay.
Like
Okay.
it's a little fin, but the crowbar, that's the actual work.
That's when you get the leg up on the table and you just reef into
just
me.
completely just taking out all my day's stress and anger
Nice.
on you.
Nice.
Yeah, no mercy.
I like that.
On that note, though, serious note, if this is too painful or it's uncomfortable, the word is stop. Okay, you
No,
say
I'm all
stop, my
good.
hands come right off. But otherwise, I'm going to ignore any oohs, ahs, or begging for mercy, okay?
Perfect.
Actually, for you have to say, my name is Will and I am soft, please stop. You say that, and I will stop right away, sir.
Okay.
100%, yeah. Just got to be on camera.
That's
and
a
upload
lot
on the
to
internet.
say in pain, too, eh? A lot of words.
I hope you don't forget.
Yeah.
And if you do, well, your problem. Like,
It's your duty to make me feel better, so you gotta do what has to be done.
it is, actually. I did take an oath. Chiros take oaths, too.
Do you?
Yeah, we do. We legitimately do take an oath. It's modified, but we do take one. And it involves, putting the patient's interests first and always doing what we can to help them. So, at the end of the day, I might be a sarcastic asshole, but I am still trying to help you, I promise.
Are you sure?
Mostly.
Okay.
Depends on the day that I've had,
Oh, that feels...
Like
Crunchy.
a crowbar? Yeah. So, the crunchiness that you're feeling, that's actually... Have I talked to you about fascia? I think I have, haven't I? Maybe not. If I
A
haven't,
little
that's
bit,
fine.
yeah.
So, fascia is that connective tissue layer that sits on top of your muscle. And we actually have that redness that I was talking about showing up right here, okay? The crunchiness is kind of a adhesion or a knot forming within that fascia that isn't supposed to be there, okay? It can happen because of stress. It can happen because you're too sedentary. Not that you're sedentary. You're obviously an active person. But it can get tight for any number of reasons, okay? Now, fascia responds really well to this kind of intervention because it's superficial, and the scraping is superficial. So, yeah, that's why you're getting this redness, because we're releasing that adhesion, and the crunchiness should calm down as we keep working on it, okay?
Wow.
Not necessarily within one session, but over several sessions at least.
Oh, that's good. That's good.
How do you think so?
That's like an itch that I could never...
Get yourself?
Yeah,
That's okay. That's what I'm here for.
that's a good spot. I think it makes sense, because
You've always had left side.
the left side is my enemy.
Yeah. If only you were all right. Get it?
That was terrible. Good one, Adam.
Thanks, Will.
Well,
That's
should we cut it there and try that one again?
no, we're finished. The video's over. That's the best pun I've ever had. Okay, how have I not made that joke before? So if I can ask, you said that you're in finance, right?
Mm-hmm.
How do you get drawn to that field?
Well, my dad is in finance
Mhm.
in a different kind of area within
Okay.
it. So I grew up kind of,
Surrounded
hearing about
by
it,
it,
surrounded
yeah.
by it, and I just kind of got really interested in investing at a very young age.
That's very, very fortunate for you, because
Yeah.
time is the best asset you have for
Exactly.
investing.
And kind of, when you invest at a young age, I've got like 10 years of
Compounding interest.
that, but also like going through different like crises, So now when bad stuff happens in the markets, I'm like, when I was 10, that happened.
Yeah, exactly. No, I've been told that investing is it's a logical game, but everybody plays emotionally.
Yes.
Right? Where if like the 2008 housing crisis, the pandemic, not to make it political, but the tariffs that are supposedly coming in on Canada, like a lot of people get panicky and panic sell. And doesn't the market always just kind of bounce back and get higher? That's what I've kind of been told, at least.
Yeah, I mean,
this isn't investment advice. Don't follow what we're saying.
This is not advice.
Unless you want to make a lot of money.
Then
don't follow what we're saying unless you like money.
Unless you want to be the next Warren Buffett.
There you go.
Don't listen to a chiropractor and a finance guy.
No, don't. It's a trap, guys. Trust me. Yeah. Don't download Wealthsimple. Don't do it.
Don't do it.
No, it's a mistake. But you were saying?
No, but yeah, I mean, like, people always go, everyone thinks the markets always go up. But yeah, historically they have. Right, there's been lots of times when, for a period of time they don't. So, time-wise, if in 2 years you need access to your money for some reason, then sure, you have to be a little bit more strategic in what you do.
GSCs. Okay.
If you own high-quality businesses that have shown that they can withstand market fluctuations for a number of years, then the likelihood of them going and getting out of bad times is pretty high. So, if you're a long-term investor, you should invest your money.
Didn't he sound professional saying all of that? Yeah, we're degenerates, but we're professional about it. See, that was very well spoken, Will.
I learned it all on Reddit. Yeah.
Honestly, so did I.
That's where
that's where I learned everything. Yeah. Thanks, Reddit. The University of Reddit. It's all free learnings these days.
Exactly.
Yeah. All right, I'm just cleaning you up here.
I love these things.
Aw, I love you. Wait, I'm not allowed to say that. Will.
I said I love these things.
I said I love you.
Yeah.
Yeah, that's
kind of awkward, yeah.
It's not the first time. Unrequited love won't be the last. No, I love massage guns too. I'm pretty sure they're the reason a lot of patients come back to me.
Yeah?
Because they feel good. Yeah, they forget everything else about the appointment except the very last thing I do, which is this. So
that's the recency effect.
Oh, yeah, that's it. They remember the beginning, they remember the end. Yeah, that's it.
That's it.
Psychological. I think I'm centered.
You're in there.
Perfect. So yeah,
way too full for the camera.
Way too jacked.
Yeah.
I'm sorry about that. I'm not going to stop. So we just finished up the treatment with Will here. He seems pretty happy. The first time we've scraped him yet, and most patients feel kind of sleepy afterwards. I don't know if you feel. No, you just had like 12 hours of sleep.
Yeah.
Didn't you? Okay, so you're fine. But how did you find the scraping to be in today's treatment?
It definitely didn't feel good in a good way.
Yeah, that I get that a lot too.
Yeah.
It hurts so good. And it's a good sign that things are happening, right? Yeah.
It definitely felt like it should be done, right?
Like,
there's crunchies in there that need to be ironed out.
Exactly, and we can iron those out. So what we would do ideally is I'd see maybe once a week going forward just to keep hitting that, and we'll find that the redness will decrease, the crunchy will decrease, and the fascia will be moving just right again.
Cool.
Okay. So at this point, Will, I usually ask, do you have any other questions for me at all for today, or are we good?
I don't think so. I think we're
good.
Yeah.
Perfect. All right. Well, thank you so much for coming in.
Thank you.
Appreciate your time, and I'll see you next week.
Don't forget to like, share, comment, and subscribe.
Thank you so much, Will.